June Sharp session called Taking the Fear Out of Prostate Screening. Recently, as most of you know, this program has changed from health education sessions to information sessions about resources, services, and tools available to help English-speaking seniors age in the right place. We decided to keep this topic. We know it's a little bit health related because it is Men's Health Month, and this is a topic that we have been long wanting to do. But we have adapted it a little bit to fit the new mandate by focusing on information to empower you for self-care and resources available for people living in the community. I want to acknowledge the Quebec English-speaking community organizations that are with us today. If you have any questions about the presentation or the resources provided, please contact the organization and the SHARP coordinator or Sharpie that invited you. My name is Erica Botner. I'm the program manager for seniors and the CHEP program at CHSSN. I'll be the facilitator. We're also delighted to have Jennifer Hobbs here with us today, one of our favorite presenters. So throughout her career of 48 years, Jennifer has held a variety of positions in geriatrics, community health, nursing, health education, emergency care, occupational health, as well as with the Canadian Heart and Stroke Foundation as a master instructor in CPR. Jennifer holds a Bachelor in Community Nursing from Concordia University, an Applied Masters of Science in Epidemiology and Biostatistics from McGill University, as well as a Postmaster's Diploma in Nursing Education from Chapel Hill University in North Carolina. She is the Senior Advisor for the Community Health Promotion Programs for Jeffrey Hale Community Partners in Quebec City, and a Surveyor for Accreditation Canada, both nationally and internationally. So we always love having Jennifer present, and I think we will hand it right over to you.
Well, perfect. Good morning, everybody. Excuse me, a few little allergies, seasonal allergies attacking my little throat there, so I apologize for my voice. But good morning, everybody, and it is certainly a delight to present this topic. And as Erica mentioned earlier, it has been a long time coming. We have not devoted specific time for men's health or for prostate screenings per se in a long time. So I think it's very timely. And just to let you know, when I was preparing the research for this presentation, I went in with my past knowledge of prostate health, and I was very interested in my learnings. So I'm anxious to share what I learned in doing my research on this presentation. This presentation really does aim to take the fear out of all things related to your prostate. And how do we do that? Well, through enhancing your awareness of the warning signs and symptoms of an unhealthy prostate, as well as empowering you to take control of your prostate health through timely screening and maintaining a healthy prostate lifestyle. This presentation will also review the advantages and the disadvantages of prostate cancer screening using the most recent best practice guidelines. But please, however, you should speak with your healthcare provider to decide what is best in your individual situation. At the end of this session, it really is my hope that you will understand more clearly what is prostate cancer. Be informed of the prostate cancer risk factors. Develop self-awareness as to prostate cancer signs and symptoms. Take control of your life by learning the pros and cons of prostate cancer screening. Know your options with regards to prostate cancer screening tests. And moving forward, independently, you can strive towards maintaining a healthy prostate lifestyle. At the end, we've included some resources and references so that you can really autonomously learn more about this subject. And we also have included websites where you can get additional information to empower yourselves to learn more about prostate screening, cancer, and everything to do with it. So let's move now to what is the prostate? Well, okay, here we go. Right in the middle. I'm circulating it here. That is the thing that causes a lot of challenges in men. The prostate gland, because that's what it is a small rubbery gland about the size of a ping pong ball. And it's located deep inside the groin between the base of the penis and the rectum. It's very important for reproduction because it supplies part of the seminal fluid, which is semen, which then mixes with sperm from the testes. And the seminal fluid will help the sperm to travel and survive. What does the prostate gland do? Well, it is not essential for life, but it is important for reproduction. Healthy semen is the perfect consistency and the environment for sperm transit and survival and for fertilization. The semen includes a very important enzyme called the M.ScA enzyme. And the long word for that is prostate-specific antigen, M.ScA, which is often measured as part of screening for prostate cancer. We're going to be chatting quite a bit about M.ScA throughout the presentation. Moving on now, let's talk a little bit about what is prostate cancer. Prostate cancer is a type of cancer, and it is of the prostate, a small gland, which we discussed earlier, located below the bladder and above the rectum, deep in your groin. It is the second leading cause of cancer-related death among men 40 and older. However, when caught early, prostate cancer can be cured more than 90% of the time. That is a very, very high success rate when we speak of cancer. Although many men are diagnosed with prostate cancer, most of them do not die from their cancer. Prostate cancer grows very, very slowly, so that many men end up dying of other causes before they even develop the symptoms of prostate cancer. And that point is very important as we move forward and talk about screening, pros and cons, etc. So we remember that prostate cancer is one of those cancers that is very slow growing. Let's talk now about being informed. We're getting into the section of the presentation that discusses risk factors. And what risk factors are simple. It says, what makes me more likely to develop a cancer than my neighbor? So those are risk factors. What makes me more likely? So the first one, the first risk factor to develop prostate cancer is age. All men are at risk for prostate cancer, but the risk greatly increases with older men. Prostate cancer is very rarely found in men younger than 50 years of age. In order, the second risk factor is ethnic background. African American men develop prostate cancer more often than white and Hispanic men. African American men are more likely to die of prostate cancer than white or Hispanic men. The third risk factor is family medical history. Men who have a first-degree relative, a father or a brother with prostate cancer are more likely to develop the disease. And interestingly enough, men with female relatives with breast cancer related to the breast cancer gene, the acronym is B.ScA, may also be likely to develop prostate cancer. And that was something that I did not know. And the last risk factor that we're going to talk about today is diet. A diet high in animal fat or, inversely, low in vegetables may increase a man's risk of prostate cancer. And when we talk about empowering ourselves to develop a healthy prostate lifestyle, later in the presentation, we're going to find some interesting things that we can do to stay healthy in that area of our body. Now that we've learned about the risk factors, what makes us more likely to develop prostate cancer, it's time now to develop some self-awareness in terms of prostate cancer symptoms. Remembering always that in its early stages, just like blood pressure, prostate cancer is very sneaky. It rarely causes symptoms. So, knowing that, let's take a peek at some of the symptoms. So, knowing that it rarely causes symptoms, most men diagnosed with prostate cancer have no symptoms. Doctors suspect prostate cancer if a blood test shows high levels of that famous enzyme, the prostate-specific antigen, the PSA. However, if the cancer spreads to the bladder and presses on the tube where the urine flows out, called the urethra, the tube that carries urine out of the body, it can cause certain symptoms. And here they are. A weak urine stream, a need to urinate often, an inability to urinate. Some men experience pain or burning when they urinate. Some men see blood in their urine or their semen. They have erections that are less firm. There is a significant drop in the amount of semen ejaculated. And some men experience pain or stiffness in their lower backs, hips, or upper thighs. Those are the more common symptoms, if any, are experienced for prostate cancer. But we do need to remember that there are rarely any symptoms in the early stages. Moving on now to taking a peek at some of the different screening tests. Prostate cancer screening involves a blood test, first and foremost, that measures the PSA. So the doctor will give you a prescription and check off the box, PSA. You do not need to be fasting for that, and you just go to your local clinic, CLSC, or physician's office and have that test done. It is a fairly routine test. Now, the PSA is a protein, as we spoke about earlier, produced by the prostate. And the PSA test measures the amount of this antigen in a sample of blood. Although many men with prostate cancer have an elevated PSA concentration, a high level does not always necessarily mean there is a cancer. This is important to remember as we move forward for the pros and cons of proceeding with screening. The most common cause for an elevated PSA is benign prostatic hyperplasia, BPH, and it's a non-cancerous enlargement of the prostate. Now, BPH is quite common in many men. Other causes include prostate infection, trauma, just from simply riding a bicycle for a long period of time, can cause elevated PSA levels, as well as sexual activity. Recent, within 48 hours before taking the PSA test of having had sexual activity, the PSA risks being elevated. Therefore, this is important to remember, gentlemen. You should avoid ejaculating or a long bike ride for at least 48 hours before going for your PSA test. Now, that's the first of the screening tests that is commonly used to detect prostate cancer. A second test is the rectal exam, an exam feared by many men. A rectal examination is sometimes recommended along with the PSA to screen for prostate cancer. However, and this is important to remember, studies have not shown that rectal examination is an effective screening test for prostate cancer. So that's something that I learned very recently. Knowing this information, gentlemen should ask themselves, should I get screened for prostate cancer? Is it a good idea? Will it serve me well? Well, let's go through this and delve in detail into this question. First of all, the answer to this question is not the same for everyone, and your doctor can help you decide based on your values and your preferences. Doctors offer screening in the hopes of catching prostate cancer early, before it has a chance to grow, spread, or cause symptoms. But it is not clear in 2023 if being screened for prostate cancer can extend a man's life or help him avoid any symptoms or problems. It might help to ask yourself the following questions when deciding whether or not to be screened. First, am I at risk for prostate cancer? Well, let's review some of the statistics. The main test, you'll remember, is the PSA. Am I at risk for developing prostate cancer? Well, on average, 1 in 6 men will get prostate cancer. But some men, as you remember, are at higher risk, including Black men and men with a close relative who have had the disease. If you're not sure that you are at risk, your doctor can help figure this out. And I think this is the first thing that you need to ask yourself. Do I fall in the high risk category? The second thing that you should ask yourself is, do I want to know? Some cancers found by screening tests are very slow growing and would not cause harm for many years, or might even never cause any harm. That means you could go through treatment for a cancer that would not have caused you harm. Some people feel better having as much information as possible, and other people prefer to take I'm going to wait and see approach. It's important for you to think about which bothers you more, the possibility of not developing cancer as early or catching it as early as possible, or the risks that come with tests and treatment you might not otherwise have needed. What if you do have a PSA and it is positive? All right. A positive PSA test is not a reason to panic. We remember in the earlier slides, non-cancerous conditions are the most common causes for an abnormal test. And this is important for you to remember, particularly the PSA test. On the other hand, a positive test should not be ignored. The first steps in evaluating an elevated PSA is usually the doctor will repeat the test. In some cases, you may be needing to be treated for prostate infection before repeating the test, because as we will remember, another cause of a positive PSA is a urine infection. Even if you are not treated for infection, you should avoid, very important, ejaculating and riding a bike for at least 48 hours before repeating your PSA. You want to put things on your side. If the PSA remains elevated, the recommendation will probably be to refer you to a specialist, and that specialist is a urologist, and they specialize just in things relating to prostate and troubles of the bladder, etc. When you meet with the urologist, he or she may order further testing, including more lab tests or an MRI, magnetic resonance imaging scan. And the specialist may perform a prostate biopsy. Let's talk some more about a false positive result. 2 out of 3 positive PSA tests end up being false positives. I'm just going to let that sink in for a moment. 2 out of every 3 positive PSAs are false positives. This means the test suggests cancer when there is actually no cancer. This can lead sometimes to unneeded worry and extra tests, including a biopsy. Think about what bothers you more. Once again, the possibility of not catching cancer as early as possible, or does it bother you more having the risks that come with tests and treatment that you might otherwise not have needed? We mentioned 2 out of 3 are false positives. We mentioned that one of the tests that the urologist will more than likely send you for is a possible biopsy. If it comes back positive, you will more likely need a biopsy to examine more deeply if a cancer actually exists. And from the research, the test can be painful, and sometimes it comes with a risk of infection. Next step, would I want the treatment? Would I want to be treated if I learned I had prostate cancer? Now, for some men, active surveillance might be an option. That's a fancy way of saying, I think I'm going to wait and see, but I'll be very, very alert to any changes in my body. That is active surveillance. Men who choose this option do not have treatment right away, but they do have routine tests to test or check whether the cancer is starting to grow. And if so, they can start active treatment then. Otherwise, some men wish to get treatment right away. They are nervous, or their doctors suggest treatment rather than the active surveillance approach based on what they find in the biopsy. Now, the treatment that we are referring to here, it usually includes radiation and surgery.
What are the other treatments besides radiation and surgery?
Mm-hmm. those are the predominant ones. Again, in the research, that is what came through on all of the sites that I research now. When it says radiation, you have a few choices in radiation now. And because things are evolving so much now, they have pellets that are inserted, they have localized radiation therapy. I mean, there's a lot of different beautiful treatments that they've been able to target the dose of radiation that it just hits at that sweet spot, and you don't have a lot of the side effects that come with it like in the olden days. And that's the beauty of research and the beauty of medical advancements now. It is an art form. Radiation has become an art form, as has chemotherapy. But the big ones are, they usually try to remove it, or they radiate it, or it's a combination of both. There's a very good, I think it's about a 5-page document that I would encourage you strongly to look at. It dates to 2013. There has been a revision. The information in it is still valid and accurate, and it is a self-care information pamphlet. And it really goes through some of the things that we've been talking about already. And it includes knowing that prostate cancer screening involves tests for cancer in men who often do not have any symptoms of the disease. Yes, on occasion it can find cancer at an early stage. However, in 2023, from the sites that I researched, including the Canadian Medical Practitioners Association, the medical experts agree that prostate cancer screening should not be routinely ordered for all men, and that screening can lead to both benefits and harm. And I found this booklet that you see up on the slide, and you simply have to click on the link at the bottom, and it'll bring you right to the website, and you can download or read the pamphlet on screen. It's an excellent guide to help you make an informed decision, to take things into your hands at first and learn. Make an informed decision on whether or not you wish to pursue prostate screening. So now we're going to get into a little bit of the pros and cons of prostate cancer screening. Let's start with the pros. Why would I go for prostate cancer screening? Okay. There's a number of arguments for and a number of arguments against. And at the end, it really is you with your physician who will come to a decision. Let's look at some arguments for screening. Experts in favor of prostate screening cite the following arguments. A study, results from a large European study of prostate cancer screening, found that men who had a PSA testing had a 20% lower chance of dying from prostate cancer after 13 years compared to men who did not have prostate cancer screening. Men who had the PSA testing also had a 30% lower chance of developing metastatic disease. That means cancer that spreads to other parts of the body. A substantial number of men die from prostate cancer every year, and many more suffer from the complications of advanced disease. For sure, for men with an aggressive prostate cancer, the best chance for curing it is by finding it at an early stage when treating it with surgery or radiation is still an option. And studies have shown that men who have prostate cancer detected by PSA screening tend to have an earlier stage cancer than men who have a cancer detected by other means. The 5-year survival rate for men who have prostate cancer, confined only to the prostate, not metastases, in the early stage is nearly 100%. And we mentioned earlier this in the presentation that 90% is the going statistic for cure. This drops to 30% for men whose cancer has spread to other areas of the body. So when it is in situ, that means when it is localized to the prostate gland, caught early, radiated, and removed, the chances of 5-year survival are between 90 and 100%. However, many early-stage cancers of the prostate are not aggressive, and the 5-year survival of those will be nearly 100% even without any treatment. The available screening tests that are out for prostate are not perfect, but they are easy to perform and have, according to the science, fair accuracy. Okay, let's take a peek now as to some of the reflections or the cons of prostate cancer screening. Other arguments have also been made against screening, as we've mentioned earlier. Even though the European study that we cited earlier found a benefit of prostate cancer screening, the PSA testing prevented only about 1 prostate cancer death for every 1,000 screened on men after 13 years. Furthermore, 75% of men with an abnormal PSA who had a prostate biopsy did not have prostate cancer. So 75% of the men who went for the biopsy with a positive PSA, 75 of them did not have prostate cancer. It was a negative biopsy. Many prostate cancers detected with screening are unlikely to cause death or disability. Thus, a number of men will be diagnosed with cancer and potentially suffer the side effects of cancer treatment for cancers that never would have been found without prostate cancer screening. In other words, even if screening finds a cancer early, it's not clear in all cases that the cancer needs to be treated because it is so slow growing, and the majority of men die of other causes other than their cancer. That makes things a little bit more confusing, but it's worth reviewing, reflecting, and reading the documents that I have attached in the references and in the resources. It's worth doing a little bit more homework to know if you want to go for screening or not, especially if you are symptomatic. There's no question, you go. But if you do not have any symptoms and you do not fall into the high risk category, I encourage you to do a little bit more research and reading to make a more informed decision with your physician. Moving forward, let's talk now about maintaining a healthy prostate and keeping it that way. As I mentioned, I did use in my research best practice guidelines, some very, very great research areas and research institutions, and including the Harvard University Medical School. And they published a peer-reviewed article last year indicating the following findings on how to maintain a healthy prostate. And we talked earlier about the importance of eating more fruits and vegetables, eating more legumes and whole grains, reducing, and as does the Canadian Food Guide, encourage us to maybe reduce a little bit dairy products and our quantities of red meat. Eating fatty fish will help, staying fit and active, consuming more green tea and coffee, surprisingly, and importantly, mental health management. Let's look at each one of these independently. So eating more fruits and vegetables, what that does, a healthy diet is the #1 remedy for a healthy prostate gland. That surprised me tremendously. A healthy diet. So fruits and veggies are the best diets to keep your prostate gland free from disease. They are rich sources of antioxidants, which have been shown strongly to prevent cancers. They include vitamins and a plethora of minerals. Go for those vegetables and fruits that are of bright color, such as tomatoes, watermelons, pink grapefruits, guava, if you can afford it, papaya, if you can afford it, broccoli, cauliflower, cabbage, Brussels sprouts, bok choy, and the famous kale. Next, eat more legumes and whole grains. What does that mean? Well, legumes such as beans, lentils, peas, and whole grains such as oat, barley, and quinoa are excellent sources of fiber, protein, phytochemicals that can protect greatly against prostate cancer. Trying to reduce by a little bit our consumption of dairy products and quantities of red meat, well, try to reduce by a little bit milk, cheese, yogurt, and reduce a little bit some of the beef, pork, lamb, and goat. Because these products have shown to have an increase the risk of prostate cancer, or the BPH, that's your benign prostate hypertrophy, because the level of hormones or calcium in the body elevates with these products. So opt more for some fish, skinless poultry, eggs, soy products, because they're a healthier source of protein. Fatty fish, what is that? Well, fish such as salmon, tuna, mackerel, sardines, they're very rich in omega-3 fatty acids. And these omega-3 fatty acids are a wonderful anti-inflammatory, and they assist with the blood vessels and help you to stay and maintain a healthy prostate. By staying fit and active through regular exercise, but remembering no vigorous biking or any biking 48 hours before your PSA test if you opt for that. And it can help you by doing regular exercise, stay healthy, maintain a healthy weight, prevent obesity, which is a risk factor for prostate cancer. It improves your blood circulation, your immune system, your mood, and your energy level. And try to aim for about 30 minutes of moderate physical activity on most days of the week. And you can break it up. It doesn't have to be done in one shot. There's a lot of encouragement for us to drink more green tea and coffee, surprisingly, because they contain polyphenols and the caffeine, which have shown to have anti-inflammatory properties, as well as antioxidant effects on the prostate. And there are quite a few studies that have shown that drinking green tea may lower the risk of prostate cancer overall. Maintaining a healthy mental state can reduce stress. Stress reduces hormone levels that can sometimes be dangerous and have a tremendous effect on your immune system, which directly influences your prostate health. I found a really interesting online resource in doing my research for this presentation, and it is called Procure. Now, Procure is an online website, and it was founded in 2003 by a man by the name of Morgan Kustner, and Procure is a charitable organization. And it has one mission. It fights against prostate cancer through many different ways. It educates, it supports, and informs people affected by prostate cancer or those individuals who want to learn more about preventing. It promotes and contributes to the financing of world-class research on prostate cancer. The mission, you have the link to the website And one of the wonderful things that they do have is a 24-hour, 7-day-a-week health specialist that you can call and chat with, which sometimes is really helpful when you're not sure. If you see something, you're having difficulty urinating, you start seeing something in the toilet that you're not fond of, and you just want to touch base with someone, keep this phone number handy and this website handy. They also have tremendous information on their website about proper eating, exercise tips, the signs and symptoms, risk factors, the pros and cons of screening. So it really is a one-stop shop when you're looking to find an easy resource to be able to stay in your home, learn independently about what you need to ask the doctor and what you can handle on your own. Once again, here is the listings of what they offer you. There is also a free book on prostate cancer if you want to order it. They offer conferences by experts with special events, most of them online, which enables you to attend virtually. And it really is a great guide for Quebecers. Easy access, free, and it's a comprehensive website. It really is. I encourage you all to take a look through it and spend some time on that website. We always like to include the resources and references, and you have them here listed. And the ones that I have set a separate slide for earlier in the presentation are the ones that I really do encourage you to spend more time. The first two are great. The Canadian Medical Association, it has a lot of great information on prostate if you have a little bit of medical terminology know-how, but the majority of them are really reader-friendly, and you should enjoy going through them if you have some time.
So I want to thank you all for your engagement with this presentation today. Hope you will share it with someone else what you have learned here today as well. Thanks again to Jennifer for the excellent presentation. I think that means that everything was very clear and everything was very concise, and everyone is feeling empowered and knows, that this is something that they can talk to their doctor about, and knows where to find some really great and simple resources.